Hi, this is the second video on anorectal disorders. We will discuss rectal bleeding in this video. Now, rectal bleeding comes in a variety of forms and again is a frequent complaint in primary care offices. I thought we'd proceed by describing when the blood appears and under what circumstances, breaking it down that way. Bright red blood on toilet tissue can be a result of internal hemorrhoids. Now, hemorrhoids, also called piles, are swollen veins in your anus and lower rectum. They're similar to varicose veins. Hemorrhoids may result from straining during bowel movements or from the increased pressure on the veins during pregnancy. Hemorrhoids may be located inside the rectum. These are called internal hemorrhoids, or they may develop under the skin around the anus. These are called external hemorrhoids. Fissures. An anal fissure is a small rip or tear in the lining of the anal canal. Fissures are common and are often confused with hemorrhoids. Or anal cancer. Again, anal cancer signs and symptoms include bleeding from the anus, pain in the area of the anus, a mass or growth in the anal canal, and anal itching. Blood and mucus can also appear on underwear, and this can be caused by hemorrhoids or a prolapsed rectum. A rectal prolapse occurs when the rectum, the last section of the large intestine, falls from its normal position within the pelvic area and sticks out through the anus. As the rectum becomes more prolapsed, the ligaments and muscles may weaken to the point that a large portion of the rectum protrudes from the body through the anus. Now, blood and mucus can be mixed with stool, and this can be caused by colorectal cancer. Colon cancer is a type of cancer that begins in the large intestine, the colon. The colon is the final part of the digestive tract. Colon cancer typically affects older adults, though it can happen at any age. It usually begins as a small, non-cancerous clump of cells called polyps that form on the inside of the colon. Over time, some of these polyps can become colon cancers. Proctitis. Proctitis is the inflammation of the lining of the rectum. The rectum is a muscular tube that's connected to the end of your colon. Stool passes through the rectum on its way out of the body. Colitis. Colitis is a chronic digestive disease characterized by the inflammation of the inner lining of the colon. Ulcerative colitis is an inflammatory bowel disease that causes long-lasting inflammation and ulcers, sores, in your digestive tract. Mucosal polyps. Now, blood can also mix with stool, but without mucus, and this may indicate colorectal polyps. Colonic polyps, as we previously discussed, can also be called colorectal polyps, are growths that appear on the surface of the colon. The colon or large intestine, again, is a long hollow tube at the bottom of the digestive tract. Colorectal cancer can also be a cause. Melena, black tarry stools, indicates a GI bleed, gastrointestinal tract bleed, occurring at a point that requires a long transit time for the blood to reach the anus. Significant bleeding, which is not frequent, would indicate diverticular disease. Diverticular disease is a general name for a common condition that causes small bulges, diverticula or sacs, to form in the wall of the large intestine. Although these sacs can form anywhere in the colon, they are most common in the sigmoid colon. Angiodysplasia. Angiodysplasia is the most common vascular lesion of the gastrointestinal tract. And this condition may be asymptomatic or it may cause gastrointestinal bleeding. Now, when you find large volumes of mucus in the stool, accompanied by small amounts of blood, this would indicate a villus papilloma of the rectum or colon. A villus papilloma is a tumor which involves the rectum and less commonly other segments of the colon of elderly patients. So, if you have blood or mucus presenting in your anal area or stool, it should be discussed with your physician. Well, I hope this helps. Have a good day.